Dr. Cole, I would be curious to know your opinion on RFK's recent opinion piece on the measles vaccine from a few weeks ago. Do you feel like he's sold out for the agenda and big pharma?
Do I?
Ooh!
Dun, dun, dun.
This person said, I've recently been diagnosed with POTS, but I can't seem to get any answers on what causes it and how to help it. I would love to hear Dr. Cole talk about this.
So POTS is an inflammatory dysregulation of the autonomic nervous system.
Will has accused me in the past of having what's called female ADHD.
I'm not accused. I'm a doctor.
Yes. So
I read recently that people with ADHD die sooner than people without. Biggest question, do people with ADHD die sooner than people without?
So, what's up and welcome to the Art of Being Well. We have a giveaway every few weeks whenever we feel like it, whenever we're feeling benevolent to the people. Giving away free signed books. You can pick out which one you want, Ketotarian, the Inflammation Spectrum, Intuitive Fasting, or Gut Feelings. And if we're giving away free supplement protocol stacks that we have at drwillcole.com, one for hormones, one for nervous system health, one for gut health, so many other ones, inflammation. And we're giving away free telehealth consults. So you can pick which one you want, either the book, the protocol, or the telehealth consult, if you win. So for a chance to win, head on over to Apple Podcasts and rate and review The Art of Being Well there. Tell us what you love about the show. You can leave your Instagram handle in the Apple Podcast review itself, or you could take a screenshot of that review and message us on Instagram at Dr. Will Cole. Follow The Art of Being Well on Instagram. I always forget to say that. And yeah, my team and I will randomly pick winners. They'll reach out to you. You can tell them which one you want if you win. So who doesn't like free healthy stuff? Get on it. People love it. People love free healthy stuff.
Yeah,
right?
They do.
And something that I keep forgetting to talk about on the podcast, and they're going to be really happy. The team's going to be really happy that I remember this.
Okay.
Entire episodes of The Art of Being Well on YouTube.
Oh, yes.
Yay.
Yes.
You've been asking for years, and we never did it because we're busy with patients and we're not, this isn't our full-time job.
We had to bring someone in to help us.
Yeah, we had to bring a YouTube guy in it. Now we have a YouTube guy. And Chase is amazing, and he's making it happen. So you have the entire episodes. You can listen to it still, obviously, if Apple Podcasts, Spotify, all those streaming platforms that the podcast is on. But if you want to watch it, these Ask Me Anything episodes or me with the guest, you can on YouTube and stream it on TV and, all the things that people do. So that's exciting, right?
Yeah.
Oh, yeah. Who doesn't want to see us and also listen to us, right?
Yeah.
Me.
Yeah,
I also
me, I
something that I don't feel like you hear enough is you have a great podcast voice.
Me?
Yes,
Yes, you do.
Wow.
You really
Thanks,
do.
guys.
Yeah. I'm here for it.
I did not know that.
Yeah,
do.
there's a measurement of that. I really
Okay,
feel like there
right.
should be.
You're
There's
in
two
the- you're
people
in the
that have
top
known me for a
percent.
long time and do not give out compliments
Definitely
easily. This is like,
Wow.
this is valuable. This is priceless. Can we timestamp that, Chase? Timestamp that, Jackson?
We'll just replay it for you at Christmas
Yes,
time
please,
as our gift
please.
to you.
Every holiday, I would love that. When I'm feeling down and there's trolls on social media, I'll just replay it. Oh, see, someone loves me. All right, let's jump into it. So we have Ask Me Anything episodes. So submit your health questions. You can be as wild and weird and wonky as you want to.
I mean, you can
Those
ask
three
us
Ws.
anything.
Yeah, you'll fit right in.
You did. You
Nutrition, yeah, I'm not going to even go there. I'm
wild
not
and
going to go
weird
there.
and wonky.
It could be about nutrition. It could be about food. It could be about labs. It could be
Yeah.
the health sciences, the latest research you've read, health trends on social media.
Are aliens real? Like whatever
Yeah.
random
Yes,
things
We
you
may
want
throw
I'm
something
here
like
for
that
that.
in. We may throw something like that
Yes.
in.
Dolphins, whales, whatever
It's
you want.
the art of being well. So it could really be all encompassing. But we're in functional medicine. So if you want a functional medicine hot take on any health topic, submit it to us. Email hello@drwillcole.com.
Yes. Do you want to mention that you're going to be also collecting questions from anything that doesn't get answered on Instagram as well?
Yeah. So we've been screenshotting. I do AMAs on Instagram at Dr. Will Cole, and the things I don't get to, we add them to the Google Doc for the podcast Ask Me Anythings too.
Yeah.
So yeah.
So really, this is a pitch for follow us on Instagram, follow our podcast, follow our YouTube. We're all in all those places.
We are living there. All right, so let's jump into it. And if you don't know Andrea and Emily by now, who the heck are you? What rock are you living under? But they are two brilliant members on my patient team. They're functional diagnostic nutrition practitioners. I've worked with them since like 1975. So just kidding.
We look really good. We're vampires.
You may have been alive.
Shut up.
But
I'm not. I'm a 80s baby. It's not that old. And Andrea's 80s. You're 90s.
I'm a 90s girl.
Yeah.
But not that far away from me, by the way.
She's somehow
No.
like, millennials. We're all millennials, right? Are you a millennial?
I'm
Yes.
a millennial, yeah.
We're all millennials. I'm an
there.
elder millennial.
I'm a middle-aged
millennial. And Emily is a younger millennial.
But I'm a geriatric millennial at heart.
100%.
Yeah.
Yes.
Yeah.
Yes.
Anyways, so they're on my patient team, and we see patients around the world and look at labs and get them healthy. We love what we get to do. So these are hot takes from questions from you all. Let's get into it.
Yeah. All right. So first question. This person said, I've recently been diagnosed with POTS, but I can't seem to get any answers on what causes it and how to help it. I would love to hear Dr. Cole talk about this and how it might impact my life and if there's anything I can do about it.
Yeah. So POTS is an inflammatory dysregulation of the autonomic nervous system. It, like any other inflammatory or autoimmune problem, exists on a spectrum. And so if I didn't say it, it's postural orthostatic tachycardia syndrome. So some classic POTS type symptoms are going to be things like heart palpitations, increased heart rate, dizziness, vertigo, brain fog, fatigue, feeling like you're going to pass out. Those are some of the common ones, arrhythmias. So there's a histamine intolerance, which I'll get into that sort of mechanism. There's a histamine intolerant component to many POTS cases. So it's nothing new in our world. POTS can be triggered by any number of things. For 15 plus years in our space, like Epstein-Barr virus, viruses historically can trigger POTS. Like they can trigger other autoimmune problems. Stress and trauma, unresolved trauma, stress can trigger an autoimmune issue like POTS. The underlying gut problems,
Chemicals,
environmental toxins, man-made toxins, other biotoxins like mold, mycotoxins can trigger POTS. So there's a phenomenon that we're seeing an uptick since 2020. Since the pandemic, we've seen an uptick in POTS cases because the COVID virus has been shown to be particularly good / it's not a good thing, but it's effective at triggering POTS in a pretty significant swath of the population. So I pulled up a few studies here. A review study published in 2023 estimated that based on all the studies to date that had been done, anywhere between 2% to 14% of COVID survivors develop POTS within 6 to 8 months of infection. So given that 500 million people globally have been infected, beyond that, had COVID-19 by early 2023 at the time of that study being done, this could translate to millions of potential POTS cases, right? This is a novel virus, right? And then the conversation is, because some of these studies looked at vaccinated and unvaccinated people. According to the studies that I have seen, getting the virus is about 5 times more likely, meaning if you naturally got COVID, if someone that's genetically susceptible, and there are genetic components, many that have to be explored and things that we see a very high correlation with when we look at labs. Anyway, people that naturally get COVID-19 about 5 times more likely to get POTS versus vaccinated, which I think there's more studies need to be done, but the vaccine itself has been shown to trigger POTS cases in some people as well. But according to the data that's out there, lower with vaccine likelihood of being triggered, having POTS triggered compared to getting the virus. Now, anecdotally, every time I talk about POTS, there's a lot of people in the comments that said, I did get the vaccine and I had symptoms after the vaccine. And there's people that say I'm unvaccinated and it triggered me. So it is a bit of both. I certainly want to be clear. I'm not like anti I'm pro-choice when it comes to vaccines, especially people that have a health history of autoimmunity. This is a conversation between you and your doctor. You need to have informed consent. You need to know the relative risk factors and the potential benefits and protection that the vaccine can give you. And we've talked about that ad nauseum on the podcast. So hopefully you can understand sort of our nuanced perspective on this. And I don't want to fearmonger by any means about these topics. These are sensitive personal topics that people can decide for themselves what they want to do. But so that's kind of what's going on. Now, I don't know, this person didn't say they had COVID or anything about the vaccine.
No, they didn't.
But a functional medicine approach to POTS or any autoimmune issue, and let me give you the data on this. So the autoimmune component, specifically, the study is around the acetylcholine receptor site antibodies. Research shows that a significant number of people that have POTS have antibodies to acetylcholine, which is a neurotransmitter, and also have antibodies to the adrenal glands and adrenaline. So it makes sense when you look at the mechanism of action, their autonomic nervous system can't regulate itself. So as this a hypovolemic component to POTS, meaning the blood flow can't get to the heart fast enough. So the heart overcompensates with tachycardia, with increased heart rate. So that's why you feel like the fluttering, the heart palpitations, the increased heart rate, because of the body, the nervous system's inability to regulate blood flow to the heart. So the body's trying to create homeostasis to keep up with that. So we have to look at those mechanisms and understand, okay, what triggered it? Okay, and that's part of health history and labs and context. Address those root causes if you can, right? In many cases, you can significantly support a lot of these root causes and address it, and then deal with some of these mechanisms. So the hypovolemic dysautonomic sort of aspect of POTS, we want to really help to regulate the nervous system, right?
This is actually interesting you're saying this, because I know you brought up viruses first, and we know autoimmune standpoint, there's a lot of things that can trigger it. But I was just thinking back about some of our more recent POTS patients, and I think out of the 5 that I'm recalling in the last, 6 to 8 months, I would say at least 4 of them, I asked about stress responses around that. And a lot of them had some sort of trauma, whether it was a loss of a job, or they were taking care of a sick parent, or finances was a big one for one of them. And they developed POTS syndromes after it. And it's just interesting. You're talking about like the adrenal component, and then like that fight or flight response that can happen. So it's just, it makes sense with what we're seeing on a day-to-day basis.
So it's multi-pronged. A functional medicine approach to POTS is multi-pronged. You have to deal with the nervous system regulation component. You have to deal with the inflammatory component. There's a significant percentage of people with POTS that have inflammatory markers. And you have to deal with the mast cell activation component too. Which is the histamine intolerance. Mast cells release histamines. So things like mast cell stabilization is really important. So there's pharmaceutical options, and then there are natural compounds that have been shown to stabilize mast cells, like vitamin C and quercetin, and supporting mitochondrial health, things like CoQ10. Optimizing gut health is a significant component. Improving vagal tone, which is a significant component, because that's regulating the parasympathetic, which is weak right now. In those cases, that resting, digesting is weak. That sympathetic fight or flight hypervigilant response is overactive. So to support vagal nerve toning in these cases, another component. So it's not one thing. Sorry, Emily. It's not just one thing. It's multifaceted, but these are the type of things to consider and things that we would do.
And it's that, it's that bucket approach. Like the reason we're seeing the stress response be the trigger was because the bucket was probably full with all of those variables, and this was the overflow.
And that's what I was going to say too, is it the chicken or the egg kind of thing, right? And I love that you brought up gut health too, because I feel like a lot of our POTS patients are also showing these gut distress symptoms. And so of course, with what this is correlated to, right? We have to sometimes take that systemic approach of, we want to bring relief to these symptoms, but we can't just address those things. And so we need to look at your gut health. We need to look at where these things are stemming from, the viral overloads, the toxin overloads, because the trauma, right? We have to look at all of those different factors because that's going to play a huge portion into addressing and actually bringing long-term relief.
Upping yes to all that stuff. And something I didn't mention that's like a low-hanging fruit is finding a therapeutic amount of electrolytes
Yes.
to maintain the
We
hypovolemic.
cannot not mention
Yeah,
that.
that's like
Yeah.
it's like so foundational for someone with POTS as they're healing. And as they heal, that requirement for electrolytes is going to dissipate. But making sure you're dosing sodium, potassium, magnesium, these electrolytes that maintain fluid balance, in turn blood volume balance in the body, which is needed not just for blood volume balance, but also for that nervous system component. So for that neurocardiac connection there is really important for a POTS case.
Yeah, and this is where working with a practitioner can come into, because sometimes that dosage is a lot higher than what you might see in just the average person.
Yeah.
Right.
Which scares some people because
Yes.
it's like,
Yep.
I'm having how much sodium?
Right.
But it's a tool within the toolbox to alleviate some of these POTS flare-up symptoms.
Yeah, absolutely.
It's good.
All right, next question.
All right, cool. Let me pull up our next question. It says, I read recently that people with ADHD, and I guess we can say ADD, die sooner than people without. I want to understand why and how I can better support my body by not just managing the symptoms, but also longevity. Sounds like this person does have ADHD, which is why they're asking. Biggest question, do people with ADHD die sooner than people without?
So, yeah, I had heard about the study. It was published at the beginning of this year, in 2025. The British Journal of Psychiatry looked at the link between ADHD and life expectancy of adults with ADHD in the UK. So they looked at over 30,000 adults diagnosed with ADHD, comparing to 300,000 people without ADHD. And they found that people with ADHD, on average, lived 6.78 years less for women and 8.64 years less for men. So meaning 6 to 8 years, depending on who you are, people with ADHD tend, on average, when you're looking at this sort of cohort of people, live less. Now, what's the mechanism of action? What's going on there? This study didn't really look at it. So there's a difference, just because like causation doesn't necessarily equate with correlation or other way around, right? So this is certainly correlated, but we don't know the why. We just know the what. And the researchers postulated that it was due to lifestyle habits of people that had ADHD. They're more likely potentially to smoke or to drink or to sort of assuage some of their symptoms with behaviors that don't love the human body back so much. So is it more, okay, they're just more prone because of their dysregulated nervous system, right? Because of maybe the dopamine seeking behaviors. Maybe they're more thrill seekers, and we know that they are. Like ADHD tends to be towards that, and they go for more risky, unhealthier behaviors and habits. So on average, when you look at a poll, they're living shorter lives because of these not so healthy lifestyle factors. I would be interested in the inflammatory component too, right? Really of looking at, well, if ADHD is a sign of there's an inflammatory component, does that inflammatory component factor into that? Certainly, I get what they're saying as far as if someone's has ADHD and they're doing more thrill-seeking behaviors, they're living like a hard, fast life. That rock and roll ADHD lifestyle apparently is what the researchers are saying. Maybe that's more wear and tear on your body and you're living slightly less, 6 to 8 years less.
I wouldn't say that's slightly.
It's not
That's
slightly.
almost
You're
a
right. That's not
decade.
fair. It's a decade off somebody's life. Yeah. Yeah.
I'm
thinking in terms of like whales.
Oh yes, of
Yeah,
course,
so
of
like
course.
sperm whales.
Yes.
Oh my god.
Or elves.
Oh, okay.
It's a
Yeah,
drop
that's
in the
fine.
bucket.
Tortoises.
Yeah.
Like-
Yeah, tortoises.
Yeah. I want to understand this a little bit more. And this isn't me asking you to like diagnose me by any means, but
Emily is asking because we read a list of ADHD symptoms because Will has accused me in the past of having what's called female ADHD.
I'm not accused. I'm a doctor.
well, yes. So I want to understand this because
It was an unofficial official diagnosis.
I feel like
which is very different though than the symptoms of ADHD.
right. Well, yeah, explain that to me because here's the thing. I can understand, and honestly, I know for so long, especially in children and we know it can look different even in children too, but it has, for many years ago was looked at as just a behavioral disorder, and it's not. We know that it's way more than that. It's physiological speaking, but can't we just have seasons of not being able to focus as much? Like,
Totally.
Or is it a
That's such a good
personality
thing.
issue? Is it a
because you read off the symptoms and I'm like, wait a minute, that is me. But like,
And
how do
ADHD,
I-
we're making light about this, but it does show up different between men and women. It really impacts
Exactly.
somebody's quality of life.
Yeah,
So it's
exactly.
I wouldn't say we're making light of it.
Yeah,
We're making
yeah.
fun of ourselves because
right, because I'm like, wait a minute, like, is this something I'm not understanding about myself? And again, I love that research is in fact showing us that this isn't a behavioral thing. This kids aren't trying, when kids who are diagnosed with this, they're not trying to, piss off their parents. Like, these kids there are physiological things that should be supported here: nutrient deficiencies, inflammation, as you mentioned
methylation
too.
impairments.
Yes.
And
Mitochondrial health,
So-
nootropics.
How can we, and supporting longevity, I think is important, but understanding how we can just support these, methylation areas in these different areas better.
Yeah,
So
can you clarify for people that are like, oh, I didn't know there was a female
yeah.
Yeah,
classic
so-
whatever.
Tell us, Andrea.
So female ADHD, according to Dr. Will Cole, it can actually be the opposite.
I
where
need
it's
some
not
music playing below here. It's just like,
What's different for me is not the inability to focus, it's hyperfixation focus. It's like your brain can't shut off. Like, you have to be constantly thinking, doing, completing. Like, you can't rest until the task is completed. There's a little bit of OCD tendencies and I know we've talked about that on before. So it's not always the completely like whimsical component of it that people think, where it's like, oh, they're flighty, they're just going to go off and they can't stay focused. You often see this in moms too. You're like, okay, so I'm doing the laundry, but now I have to go, but I can't finish the laundry until I refill the detergent. We're out of detergent, so I need to go add that to my Amazon list. And then I get on Amazon and I realize that there's a package that I'm waiting for. So I go upstairs and I look to see if the package is there. And then when the package isn't there, I realize the dishes aren't done. So then I go and do the dishes. It's this constant inability.
that just stressed me out.
Yeah, actually, my heart rate is increasing.
So, welcome to my brain. And so this is, and for all intents and purposes, a form of ADHD. It can look different for each person. It's not that I have the inability to complete tasks. It's actually that I'm trying to do too many tasks at one time. And I can tell you anecdotally and professionally, when you look at my labs, when I am not taking care of certain detox pathways, certain methylation pathways, if I'm not getting enough sleep, these things, certain parts of my cycle, these are all things that can intensify or worsen at different times. And so we do know that there has to be some physiological component to what's happening with ADHD.
Right.
And not just physiological, but malleable.
Right.
Yes.
Yeah, you have
Yeah.
agency on it. It's not something you're just broken or there's not immutable. It is something that you have agency on decreasing the severity and frequency of it. And for some people, completely reversing it entirely.
Right.
Like what they mistake for their personality
Yes.
is entirely malleable.
Yeah, because to be perfectly honest, when I catch myself in those cycles, I've now learned to stop myself. And this is something I worked with my therapist on, was I don't become so paralyzed, because you can also then become paralyzed. Like, oh my gosh, there's so much, so now I'm not doing anything because there's just too much and my brain can't handle it. I've worked with myself, nutritionally and lifestyle wise, but personally, I've learned to recognize those patterns, and I can stop myself in the pattern. And I can say, Andrea, what do you really want to focus on in this moment? Well, I want to get the laundry done. Okay, so we'll come back to the dishes. Go back to the laundry room, sit there, refocus, and then go finish the next task. So having lists, helping myself, it's also about retraining my brain to not fall into those habits of anxiety or stress responses, but actually recognizing them so I can break the pattern that's happening.
Okay, that really helps. I'm having memories the whole time you're speaking of when I was in middle school, and teachers would be at the front saying, Glasser, wake up, you're daydreaming. And like, again, I think about these things and I'm like, okay, I know I have these methylation impairments. I mean, I have double SNPs on some of the more common ones we talk about, right? Yep. And I'm thinking like, whoa, if only I would have had some of this information back then. Because I wasn't, I was a daydreamer. I had restlessness. I definitely, couldn't focus for long periods of time. And so I do feel like there's components of that too. But I love that you mentioned that those malleable things that really can be adapted. And I do see a difference when I'm on methylation support that
Yes.
I don't have as hard of a time, kind of what you were saying of saying, okay, no, here's what we need to do. Here's what we need to get done. Here's how we need to be organized.
Yes.
So I'm almost kind of the other end of that from what you described, but I do see a major difference when I'm supporting the right nutrients. And there's a lot of nutrient deficiencies that can be associated with ADHD too.
Yeah. Magnesium.
Yeah.
Zinc. Yeah. So there's you can take whatever one you want, but when talking methylation support, I'll put it in the show notes. It's the Art of Being Well supplement line is what these two
Yes.
brilliant practitioners take. It's called the Methylator.
Yeah.
Yeah.
You're welcome for the unique name.
We love it.
We also have Be Better.
That's true. It's a lower dose.
It's a lower dose of it. So because everybody, again,
Wait, maybe that's what I needed and you just needed.
Stop it.
Yeah, you should microdose the full.
No, but I think it's interesting that this study, again, to your point, is it the risk-taking behavior or is there other components to this? I think that needs to be dug into a little bit
and the
more.
stress component.
Yeah.
When someone's stressed more, like we know the impact that stress
like
has.
if you have this complete brain meltdown because you think you have a finite amount of time to finish infinite amount of things.
And your life is spent like that, and people don't have to. I think that's why I want to get out of this, is that like you don't have to. Just because it's your everyday doesn't mean you should settle for it. And we're like, if you're constantly stressed and wired, like, all right, are there tools to lessen that? And you'll still be bio-individually you. Like there's people that are just more predisposed to certain things, but you can be the best version of you.
Yeah. Well, if it comes down to risk-taking behavior, Andrea, I think you're safe.
Yes, right. Definitely.
You too.
Me too. I'm good. Poppy is good.
You watch your historical documentaries and
I'm
whales
bird watching
with drinking tea. We'll be fine.
Yeah.
But then we have
I live
Emily,
a safe
who's-
life.
Yeah.
I am a little bit of a thrill seeker, but not to some
I
of
did
those
jump out of a
things.
plane randomly one day.
Wait, you did do that?
I
Wait a
did.
minute.
So are we saying a podcast should be called The Art of Being ADHD? It's like we'll teach you.
Well, actually,
The three
this
people
whole
on the
derailment we just had is kind of
the ADHD
like.
spectrum. Yeah, I have some of it too.
Yeah.
It can be your superpower if you channel it
Yeah.
and optimize your health.
100%.
Yeah.
All right, next question. So this is back to some hot topic stuff. I know that semaglutide is the hot topic, but I heard it can help more than just weight loss, specifically around alcohol cravings. Is this true? If so, what are Dr. Cole's thoughts on its effectiveness, or are there going to be better options out there?
Another not so long ago study published in JAMA Psychiatry just this year. It was a phase 2 randomized clinical trial led by researchers at USC and UNC. And it was a small study, only 48 participants. So that's going to be a limitation of the study.
Oh, that is a small study.
But the 48 people that had alcohol dependency and that there was no treatment. So the study followed these people for 9 weeks, and they gave them either low dose semaglutide, which we've talked about on the podcast before, microdosing smoke. They gave them 0.25 milligrams per week or 0.5 milligrams per week, that sort of low dose semaglutide peptide, or a placebo. The findings were pretty staggering here. Specifically, participants on semaglutide consumed nearly 30% less alcohol, as measured by grams of alcohol and breath alcohol concentration during a monitored drinking session. The study also reported reductions in alcohol cravings, fewer drinks per drinking day, and a decrease in heavy drinking days. Among a small subgroup of smokers, semaglutide was linked to reduced cigarette use, hinting at broader potential for addictive behaviors. And the drug was well tolerated, with 96% of the medication group completing the study, suggesting safety at these lower doses. This is what we've been talking about in the podcast for months and months, because we have seen it work for people from a neurometabolic standpoint, and that sort of compulsive, whether it's addictive behavior around food or addictive behavior now to cigarette smoke and to alcohol use as well.
Yeah, I love this because we know that, especially with working with patients for as long as we have, we hear that kind of language, right? The food chatter, and that's a real thing. It really, honestly is. And we know that it can help with that. And so I'm not surprised at all that the starting research is showing this kind of impact too. I mean, especially with that gut-brain connection.
Yeah. The gut's making GLP-1, right? It's like, what are we... and then can we endogenously naturally increase GLP-1 by improving gut health? Novel idea. Because we say that with patients without semaglutide. If you're improving gut health, you have more agency and proactive, less reactive behaviors because you're more regulated. Your neuroimmunoendocrine axis is more regulated. So you don't need a peptide to have that sort of proactive resilience in your life, less of a reactive, less of a compulsive, addictive behaviors. That's not your personality. That is a sign of a dysregulated system. So yes, the mechanism and like, can this be a tool within the toolbox, like microdosing semaglutide? Yeah, I think that's something worth exploring about with your doctor, right? But I see it as like more exciting understanding the mechanism here, and you can actually tap into this naturally without depending on a pharmaceutical, even if it's a peptide.
Yeah.
Any other thoughts?
No, I feel like
She's tapped out.
No, I just to me it always goes back to, yes, let's keep these as a thought, as something we can utilize if we need to, but to me it's the root issue of, well, what's driving the alcoholism in the first place? Is it a trauma? Is it a gut health issue? Is it a gut-brain axis? Is it inflammation? There's a lot of stuff that you can do. You can take peptides, and if that gets your head above water, do that.
And I think that's the important thing, right? Is that you're absolutely right that we have to get to the root of where these things are starting. But I think for a lot of people who are dealing with food chatter or alcohol cravings or addictive behaviors in general, it's really hard to even think about those things. It can be a little bit daunting sometimes.
Yes,
and so
it seems insurmountable.
Yes, and so I think that it is just a tool. And I think there are many other tools that are going to be helpful too. But I do think I love that there's research that is showing that it can be helpful at safe levels too. You don't have to do the macro dosing for it.
You don't have to get freaking neuropathy of the eye, optic nerve. Like,
blindness. Do we remember that one?
Yeah, that was our last
I will never
AMA.
forget.
More is not always better, America. I know you want to think differently, but so the limitations of the study: small sample size, we talked about, only 48 people. Short duration. What happened longer term? Lower doses. Which, what would happen at higher doses? Would it help them more? Right. Would you get diminishing returns? All right. Specific population too. These were people with alcohol dependency symptoms who were not actively seeking treatment. This may not reflect outcomes in treatment-seeking individuals, or it could help them more, right? It's like if they want to get better, like what's the mindset towards it? Self-reported data, lack of diversity, like the demographics were not lacking sufficient racial, ethnic, or socioeconomic diversity. Everybody's different, bioindividuality, so more studies need to be done in that standpoint, and placebo-controlled design constraints. While the placebo group helps isolate semaglutide's effect, it doesn't compare the drug to existing alcohol treatments, like pharmaceuticals is what they're looking at. Yeah. And then the mechanism, we don't fully know the mechanism. This wasn't looking at mechanism. It was an observational study, but very fascinating observation it was. So,
yeah, that's great. The more we know, the more we can keep seeking information.
The more you know.
There's that podcast. Are you?
No. Remember that Reading Rainbow at the end of the? It wasn't Reading Rainbow. It was. I'm dating myself.
Yeah,
elder millennial.
This actually sounds like a daytime.
The guy from Reading
drama.
Rainbow used to say, "The more you wasn't." Someone fact checked me. Someone on social media. You're gonna fact check me. You don't remember that? The more you know.
No.
It was like a little commercial. It was like an inspirational commercial in the 90s. The more
I'm back to judging you again.
You were just watching.
Don't worry.
Actually, the way that you said it though, like your podcast voice, it sounded like you were about to do like a soap opera introduction.
The more you know. Someone please tell me that. Well, you know what I'm talking about. Yeah. I know I can.
We're definitely going to Google this after.
The more you know, and there was a little rainbow and a book involved. That's what you said it, and it reminded.
There we go.
It triggered that dormant memory.
Yeah. Yep.
All right. Anyways, we're gonna move on. This is another study. It's study heavy. This AMA. Someone wrote in and said, I saw a study recently about the effects of antidepressants on cognitive decline and potential risk for dementia. Would love to hear Dr. Cole's take on this, as this medication has been helpful for me, but I do desire to make sure I am doing the best thing for my overall health.
Okay, so and I love that this like if you see a study out there in the whether it's like the media picking it up or you read journals for fun, you health freak, and you want to submit it to us, just email the study and your question to hello@drwillcole.com and we'll give you our perspective on it. Okay, guys, this study was published in BMC Medicine recently again. These are all new studies, which is why you guys are asking me about this. This was a cohort study that they used the Swedish Registry for Cognitive Dementia Disorders in 2017, 2018. They looked at a lot of patients that already had dementia. These are dementia patients in Sweden. And they looked at those that were on antidepressants versus ones that weren't, and even got granular with the type of antidepressants that the patients with dementia were put on, which I loved that because it wasn't just lumping all pharmaceutical antidepressant classes of drugs as one broad swath. They actually got detailed with the data. And they found that those that were on antidepressants declined faster. So these were dementia patients. So they weren't saying that the antidepressant caused the dementia. They already had dementia, but they found that those with antidepressants declined faster, and specifically SSRIs, which is the most common class of antidepressants. Things like Lexapro, for example, and I'm not picking just on Lexapro, but like that's a common one that people take and are on. They declined the fastest out of all the antidepressant drugs. The dementia patients that declined the slowest on the medications were on the TCA class of antidepressants, which is less common than SSRIs. So I found that interesting. Again, observational. We don't know why. Is it that people that had more severe dementia cases are more likely to be put on antidepressants? So of course, they would have already declined faster. Causation, correlation, we don't fully know that. But it is a fascinating study to look at how antidepressants impact the brain. We know it can really impact cognitive function. So it's a potential side effect, I should say, of people that have mood. It kind of worsens their brain health overall, long term. So we're not antidepressant for people that need it as a tool within their toolbox, but we know. And every time we talk about this studies, that the people get irritated. But I hope that they can understand the nuance of this, that the science shows that for people that have mild to moderate depression, antidepressants work about the same as placebos or worse than placebos. And to me, like you could say that as something negative, right? That you're saying they don't work. No, they do work, but that's the power of the placebo effect. Mm-hmm. And that's the power of the mind-body connection and the power of suggestion. So I think that they can be a great tool for people who need it, right?
Yeah.
But it's not, is it, I'm asking the question, is it dealing with the root cause of why you had the depression in the first place?
Right.
And these people with dementia already have neuroinflammatory, neurodegenerative changes, right? So it is interesting. But again, I think the question was more, were they questioning about the science? Let me be clear. This study did not show that the antidepressant caused dementia.
Yeah.
Right.
These are all dementia patients. So let's be clear on that. But I do think there's some, clinical pearls or
Right. I think they
thoughts to
wanted
think about.
clarity too. Like, is this something that do we know if there's any correlation with me taking the antidepressant that could possibly lead to any cognitive decline?
Yeah,
and
that's,
obviously
They could
that's not what
also-
the study showed.
And they could be
at all.
asking because they maybe have a family history too
True.
of
True.
dementia and
So
Alzheimer's.
you cannot extrapolate that takeaway from that
Right.
study alone. Because if it showed healthy people and then measured these scores, because they
Right.
had them fill out these, it was based off of this scoring system of their mental health, their brain health. So if you saw healthy people and then tracked this over time, that would be a little bit more conclusive with the mechanism and what would be, the takeaway there. But this is just people with dementia and people that were on antidepressants, specifically SSRIs, declined and got worse faster.
Okay. Well, and I think the second half of this question was, is there anything that I can do if I do want to keep taking this? Like, I think we can give them that understanding too, that it's not one or the other. Like, you don't have to go off of this to protect your brain, that there is a lot of things that you can do nutritionally, lifestyle wise, stress management wise, sleep wise, exercise. There's a lot of things that we can do. So if this medication is getting your head above water, it's helping you function, it's giving you your life back where maybe it felt stolen before, we don't want to be anti-medication, but at the same time we do want to figure out, why did you need that support in the first place? Right. And is there the opportunity to eventually not need that? So it does, again, if there is a family history or a genetic component, that we know how to navigate that. But I do think it's important to point out the study did not say it caused it. It just showed a worsening of it.
Yeah, and it poses like a question of, okay, why? And then more studies need to be done to explore those mechanisms and suss out correlation and causation. So I go back and listen to my episode on the podcast with Brooke Seam. Brooke Seam, that conversation was wild and talked about SSRIs and other medications given out. So if we can put that in the show notes, team, that would be great, because it's a good, I think, companion to this episode and this topic specifically.
Yeah. We've talked about it on mental health as physical health as well in the past.
Which are subset episodes where we do clinical deep dives on sort of the gut, brain, mental, emotional, and physical components of different health issues. Yeah.
All right, you ready for the last question? It's the juiciest.
What is with you two and juicy recently?
Well, I have these pants that say juicy across the butt.
This is the same dad joke you've been saying for days.
You didn't hear me say it, though.
I didn't hear you say it.
I played it. I did it yesterday, too, so that's why I said it. It's a new audience.
Okay. Wow.
I'll never say it again. I'm retiring. I'm retiring that joke.
Hey, better than your toothpaste stained pants.
Oh my gosh. All right. Out me.
Wait, I complimented you and I absolutely insulted you in the same episode.
Okay.
All right, that's balance for me. You have to have it.
Fluoride-free toothpaste, I'll have you know.
Okay. So Dr. Cole is not bougie at all, for anybody understanding, and he likes to wear the same H&M clothing that he's had since high school.
Hey.
And so Emily was just making fun of him.
FIFA free is right, and it lasts long. People that say H&M doesn't last long, you're too hard on your clothes.
You literally have had
it's you, not
H&M.
I've just worked with you too long, and I remember, okay? And I have to bring it up every once in a while. I got to put you in your place.
I still have those pants.
I know you do. Don't worry. All right. We're digressing. We need to move on.
Yeah.
But back to the juicy question. I had to say it one more time. Dr. Cole, I would be curious to know your opinion on RFK's recent opinion piece on the measles vaccine from a few weeks ago. Do you feel like he's sold out for the agenda and big pharma?
Do I?
Ooh!
Dun, dun, dun.
Drum roll.
So I did find it interesting that it was a Fox News op-ed and not like a statement from HHS. Why? I don't know why they did that. Bobby, why? Why did you do
Let's
that?
investigate.
I don't know why they did that, because it was sort of an official statement, but maybe, I don't know, maybe
an unofficial official statement.
Yeah, it was, and the readership maybe was greater. They could get more people out the information. I don't know. I don't know the answer.
Well,
to that.
how many news medias would have picked it up outside of that?
Like, I think they would have.
You think so?
Yeah. Regardless,
all the questions
from the voice of the administration, I think. Anyway, so what was the big controversy around this op-ed in Fox News from Bobby Kennedy, about the measles outbreak? So let me can I give you a synopsis for it? If you didn't read it, I'll read it for you.
Please.
I'll give you this synopsis of it. Kennedy expressed deep concern about the measles outbreak in Texas, which reported at the time of recording this and the time of him writing that op-ed was 146 confirmed cases since late January 2025, predominantly in the South Plains region of Texas. And he highlights the tragic death of a school-aged child, the first measles-related fatality in the U.S. in over a decade, emphasizing the seriousness of the situation. And what was controversial amongst, I think, the sort of Maha, Bobby Kennedy people, a percentage of them, because Bobby acknowledges that acknowledged in the op-ed the MMR vaccine, which is measles, mumps, and rubella vaccine, played a significant role in protecting individuals and contributing to community immunity. And he said, quote, vaccines not only protect individual children from measles, but also contribute to community immunity, protecting those who are unable to be vaccinated due to medical reasons. However, he frames vaccination as a personal choice, urging parents to consult healthcare providers to understand their options. And then he talked about how we need to have accurate information about vaccine safety and efficacy so we can have true informed consent, something we talk a lot about on the podcast. Mm-hmm. So what's my take on this? Has he sold out to Big Pharma? No, this has always been his position.
Yes.
It is having informed consent and to have informed consent, you need to have transparent data. And he's talked about openly, he's vaccinated, his kids are vaccinated, but it's having pro-choice as a patient, as a person, or as a parent for your kids. So I don't think that this is an abandonment of what he said. I think this is showing what he's always said. If I get in this position, this would be my take. He's following through with his word. And he knows his position with HHS. There's going to be lots of different opinions out there in the country, and he's representing the health of the United States. So I think, and look, Bobby's not, like, I have no connection to the administration. I'm speaking on behalf as a private citizen and a clinician who gets people healthy for a living. I don't know. I don't have any insider information on that. I would just say that that's my take, knowing him and his work for a long time. And I think that people are hyperbolic. I would be interested in people that are the deranged, perpetual Bobby naysayers. They can't see any good ever. What do they think about this? Because this is the opposite of what they said were going to happen.
Right.
He was dangerous. He was going to destroy all the vaccines, and that's not the case
Sounds
as well.
like I'm going into Haunted Mansion at Disney.
Yeah. Well, hey,
Whoa.
or worse. So what do you say now? What do you say?
Yeah. Tell us.
You on social media in the comment section.
Well,
I love you.
Yeah, we love you.
We
so
love
much.
you.
I love all the trolls. They deserve God's love too.
even if we don't necessarily agree with you or like you, we still love you.
And something that can I say this? He also said, what I loved, again, this both and not either or approach, he also talked about vitamin A and how there's exciting research for decades on vitamin A's ability to be as an option treatment for measles.
Yeah.
Not replacing vaccines per se, but as an option for people to maybe can't get a vaccine or choose not to get the vaccine, another option out there. This randomized controlled trial of vitamin A, which is retinol, right? And it was a South African study, 189 children hospitalized with severe measles. It was randomized to receive either vitamin A, 400,000 IUs total over 2 days, or a placebo. The vitamin A group had a mortality rate of 2.2% compared to 9.8% in the placebo group. That's a 77% reduction in mortality. It saved that many lives. Wow. Recovery time was also shorter. They recovered faster, 6.3 days versus 8.7 days. So the conclusion of the study, which is not a new study, this came out in the 90s, vitamin A significantly reduced mortality and morbidity in severe measles cases. Now, what we want in our community, more and more studies like this done.
Yes.
So people have true choice in their health, and we're not cherry picking data or giving preferential treatment to treatments if it's a pharmaceutical drug. Can we give food and nutrition and other out-of-the-box therapeutics, biohacks, if you will, for different health conditions, including measles?
Yeah. I think at the end of the day, this is what we advocated for RFK Jr. was because of the fact that we knew it was about choice. It was about education. It was not us Americans going in and trying to say nobody has any, we want it our way or no way. If anything, I think this brought lividity to it in the sense of he is not a naysayer to these. He's just saying, hey, I want this to be informed. Yeah. And I think I feel validated.
It's validity to it, for sure.
I feel validated in why
I'm glad you do.
Yeah.
Voted the way that I did.
What a juicy question and a juicier answer.
And let me give you this hot take of this, right? if that didn't irritate people enough, let me just say this. At the height of the measles outbreak from 1953 to 1962, prior to the measles vaccine, on average, 500 people died a year from measles before the vaccine. And the vaccine was part of decreasing that, okay? 300,000 people die every single year from diabetes complicated diseases and disorders. Tell me you have a hyperbole problem. Tell me you have a priority problem without telling me at all. Because that's the context and the nuance that's lost. Like, we are up in arms about, at the height of measles outbreak, 500 people died a year, which is sad, horrible, right?
Yeah.
Nobody should die, especially if it's preventable.
Yep.
But it's 500 people versus 300,000 people a year die from type 2 diabetes. Where's the outrage about that epidemic?
Yep.
Where's that outrage? Yeah. And especially when that's reversible, healable, overcomable with lifestyle changes. And where's the outrage about autoimmune conditions? Where's the outrage about fertility issues? Where's the outrage about these things that people are, their quality of life and their actual life is impacted every single year. But yet we look at the height of it prior to the vaccine, 500 people a year. Just remember that.
Yeah.
Share this episode with somebody that's living in fear, please.
If my mic wasn't in a stand, I'd drop it.
Yeah.
I'm going to throw it.
I'm
so fired up.
What I think is important about what you just said, at the end of the day, this is why we are also living in a much sicker nation. I mean, we are...
versus the 50s.
Yeah, we are a sick...
That's true. That is true. So measles, more people could die from measles now because we have such poor metabolic health.
I was just going to say...
But we have to look at it all, and we have to think of it all.
But then again, is that really the measles, or is it because of everything else we've done to our bodies? And that's what you should be concerned about, not whether it's measles or diabetes or autoimmune. Why are we sick?
Yeah.
And that's really why Bobby does why we wanted him in, was because he was saying, well, I don't want to just give you a choice. I want you to understand. I want to educate you.
Yes.
I want to make our people healthy again. That is extremely important to what we do.
That's very offensive, Andrea. That's very offensive.
Let it be offensive. I'm sorry. I don't want you to die. I would like you to get well.
I'm here for this conversation.
This is the Orwellian upside down when you talk about we don't want you to die. That is somehow offensive.
That's literally, if you're offended by that.
You extrapolate that. That is really what's going on.
Yeah.
Because they would...
I don't want you to be a dementia patient. I don't want you to be living with type 2 diabetes and getting your foot amputated that I've seen patients that come
And then
to
the counter argument, I'll give you the counter argument because I see these people on social media, what I would call the capital RDs, the capital doctors, the capital, in Hunger Games.
Oh, I'm right there with you.
They're the capital ones. They're the ones that are like, hear me, peons. This is the why, and this is why. And they're very fancy. They're very elitist. They're very smug. They're very judgmental. And then we're over here in District 12. And
may the odds be ever in your favor. Seriously.
So they would say it's because of capitalism, and that people are like, they don't blame anything on our food supply. They think it's entirely access. A lot of them take sort of this Marxist socialist view on healthcare, and they think if we just had more government intervention, if we just had more government centralized control, we would be healthier.
It's so illogical. I'm sorry.
It doesn't make sense.
It's illogical. It's illogical to look at something that you can look at ingredients. We've all seen them on Instagram. It's like, here, it's not the same, because people are like, oh, I used to eat that same thing, and then they show you McDonald's ingredients like fries that have 27 ingredients now.
They don't.
They're taking into account the fact of subsidies.
Right.
Subsidies are not a capitalistic thing. Subsidies are more of a socialistic thing. It's the subsidies that are lowering the prices of making these foods super cheap for poor people.
Yeah. Foods that don't even go bad.
So that's what always look. This is not an economics podcast, but what they're conflating and calling capitalism is really corporatocracy. It's crony capitalism.
Yes.
It's sort of this sort of government in bed with corporations. That's the problem. A not true fair market and free market where you really can have informed consent and people can vote with their dollars, which if you get subsidies out of, corn and soy and wheat and GMO food and glyphosate-ridden food and ultra-processed food, then there'll be, the prices will be raised for these foods, and people can really start buying things that love them back, and those prices can come down.
And to me, though, what's illogical about it is that there's no argument about things like glyphosate. You look at the World Health Organization, 10 years ago, 2015, I think they came out with this study, and they basically said, yeah, glyphosate's a known carcinogen, causes cancer. Let's keep spraying our food with it.
We don't need to regulate it.
Well, see, other countries, we're talking WHO, that's one of Bobby's points, is that like these other countries, like the FDA's equivalents in these other countries know these foods, what these ingredients, whether it be glyphosate or artificial dyes, whether we spray it with our food or color our food with it. The FDA's equivalents in these other countries do have more regulations on it, right? So,
Right.
Yeah.
Anyways, I just think that he's waking people up, but no one said that they were stripping you of your rights either. That's my take on it.
If you want to drink glyphosate, drink it up.
Fine.
There'll be more available.
Again,
That's true. On sale.
There'll be and red dye 40. Just chug it down. Chaser.
Have you guys seen that meme that it's like, if you want to drink your red 40 and drink your glyphosate, natural selection at its best. Like go have at it.
I did not see that.
I did not see that. I don't want to go to her algorithm.
Yeah, seriously. What are you watching? I just look at whales.
I mean, really, if you want our hot take, that's really what it is. No one was trying to strip anybody of their rights. They just wanted you to understand and be better educated, and not from PepsiCo and Kellogg's and all these other companies that make billions of dollars off you being sick and addicted.
Yeah. Well said. Well said. We're not dropping mics, but I would.
It's getting hot in here, guys.
Yeah, I am kind of overheated. All right, guys. If you want to learn more about our functional medicine clinic, the telehealth clinic, lots of free information, the show notes to this episode, check it all out at drwillcool.com. We'll see you next time.